libido, our mental clarity, and it kind of keeps us going throughout the day. And that's why as we age, we feel more tired quicker. We don't put on as much muscle as easily when we were 25 or 30. And that's kind of the reason why they come to us, is we can replace this safely, bioidentically, which mimics the body's natural release. And, and once we do that, we restore these guys' confidence, their body changes, they gain more muscle mass, they lose weight, and then their significant other usually says, hey, guess what? They're more of a pleasure to be around now.
Well, and that's interesting. When you speak to somebody who is bold enough to be, I guess, upfront with you about this problem, right? They will also often ask, is this different than the other pills that you see marketed, like Viagra, for example? Is there a difference between this and that?
Well, yeah, there is actually a difference. There's a difference between Viagra, which is used to treat erectile dysfunction, and then there's testosterone replacement therapy. If we talk about testosterone replacement therapy today, that is a hormone that's usually replaced. You always see about these gels and creams that they advertise on TV, or the shots. And, we try to stay away from that, as it's not bioidentical. It's not medically monitored. It's important, if you're getting testosterone, that it's done under a doctor's supervision so we can get you to the right therapeutic levels. There's this big stigma going out there about testosterone causing heart attacks and stroke, etc. Well, anything in excess or anything too much of course you're going to have side effects from it, and that's why it's got to be done on a safe level. It's kind of like red wine. They say if you drink a glass a day, it's okay, but if you drink a bottle a day, it's probably too much.
Right.
So we want to do that safely.
Good comparison, yeah. So bioidentical, can you just help us understand what that even means? Does it mean it's artificial?
Well, bioidentical means it mimics the body's natural release, and we use natural hormones to replace the body. They're actually made from yams or soy-based, not synthetic. And synthetic means they're made from chemicals in a lab that you hear about. But this is actually done, safely through pellet therapy, which we put right under the skin into the fat. It's a 3-minute procedure, and you're good for 6 months of a natural, consistent release of bioidentical testosterone being released in the body.
Wow, a 3-minute procedure. And what skin? What part of the body does it go into? And can you see it? Is it a lump or something?
You can't. No, you can't see it at all. It actually goes right under the fat in the upper buttock area, right near the hip. We put it right under the fat there. They look like little Tic Tacs that go in there, and they're just slowly released over 6 months. You don't feel it. You may feel a little bit of swelling for a couple days, but maybe a little bit of bruising, but that's it. After that, you're set.
So help me. Can I just kind of review to see if I'm understanding this? It sounds like what you're saying is if erectile dysfunction is all we're treating, then that's all that will be treated. But if that's a symptom of something bigger, what you're doing treats the whole body. I feel like I'm doing an infomercial here, but I'm trying to understand it. Am I accurate?
You're accurate. Actually, we're treating a very holistic approach. So to treat, to make a man feel better, he not only has to perform, you treat his hormones, you get him feeling better, his confidence, his libido comes back. You want to treat that part. The erectile dysfunction is usually a blood flow issue, and we have another medication for that that's actually 98% effective in restoring a guy's function down there. A lot of times you hear about the pills and Viagra and all that. That's a one-size-fits-all. Our treatments are customized and tailored, don't have the side effects of it, and instantaneously, almost within 5 to 10 minutes, you're able to perform. And I've given guys that, they tell me they haven't been able to perform for 15, 20 years. One visit with us, and I don't mean to sound like you said, an infomercial, but one visit with us, we can restore their function probably within an hour or so to get the blood flow moving down there again. And the reason you don't hear about this is because, you see all these commercials for Viagra and Cialis and everything else. They drown out the market, and you don't hear about the more effective treatments that are actually out there that really do work without the side effects of that.
And does this also help men that have had vasectomies?
Yeah, absolutely. Vasectomies, prostatectomies, if you've had your prostate removed, we have a medication there that can actually, a lot of times men lose their function afterwards. This will actually restore their function and get the blood flow moving down there again. You got to think of it like any muscle in the body. You got to keep working it out. You got to keep the blood flow moving there. A lot of times when men lose the function of what's going on down below, it's a sign that something else in the body is wrong. We've diagnosed many men with heart disease, with diabetes when they come in. We find out their sugars are really elevated. It's usually a sign, hey, if things aren't working right down there, it's probably time you go see your doctor, your regular doctor as well, and find out if you're really, truly healthy overall.
And that's really wonderful that you treat the symptoms and find out the problem before you prescribe something.
Right. We want to figure out what's going on, what's going on down there, and if there's something else. We check their blood work, their blood sugar. A lot of guys come in, their prostate levels in the blood are super high. Well, we say, you know what? Something may be going on with your prostate. We got to get you to your doctor and find out what's going on with that first before we treat the erectile dysfunction, before we replace your hormones and everything else. Let's make sure everything else is functioning right first, and then let's get you started on the hormone replacement therapy and the erectile dysfunction therapy.
Do they visibly change? And I don't mean just down there, but I mean, like, does their face, does the skin start looking better on their faces? I mean, does everything else become better?
With testosterone replacement therapy, if you think about you're replacing your hormones back to when you're about 25 or 30 years old again, right? So you actually start getting you put on more muscle mass, you get more blood flow everywhere, you're healthier, you feel more motivated to work out. So it's, like I said, it's a holistic approach. And yes, you start looking better. I mean, guys tell me they lose the belly fat, they start gaining more muscle in the upper areas of their chest. Yeah, it's amazing.
Why is this for men only, though? I mean, wouldn't women benefit from this too?
Absolutely, and that's the other thing we're doing. We also treat a lot of couples come and say, "Hey, you fixed my man. Can you fix me?" Yes, we can fix the women too, because as women age, their hormone levels decline too. You've heard of menopause, right?
Yeah.
Well, menopause, when women go through menopause, right? That's because their hormones decline over the years, and men go through andropause, as we call it. But women, if you replace their hormones just right with a little bit of bioidentical hormones, with a little bit of estrogen, a little bit of testosterone, well, they gain their function back down there as well. Their libido comes back. They're able to, the fogginess that a lot of women get, the night sweats, the irritability, we're able to, kind of just
you can fix the irritability. That's great. So is it
men and women?
Is it a tic tac in the hip for the women too? A tic tac in the hip?
Yes, absolutely. It's a little tic tac in the hip, and actually we can use creams for women too if they want to start with that. The tic tac in the hip lasts about 6 months, and we always start a little bit lower with women to see how they respond to the medication and everything, and then, or the hormones, and then, we can titrate upwards from there. We can kind of fine tune it for them, but we don't put as much in women as men, because women don't need as much of the hormones as men do.
Do you give emotional counseling as well? Because this is a huge step. I mean, it has to be high anxiety. The man or the woman hasn't been able to do anything for their partner, and all of a sudden they're getting something done that will allow them to do that. That has to be high anxiety.
It is high anxiety. We have referral people that we can send them to counselors and therapists, et cetera, in case that's it. But I'll tell you something about, I'd say 90% of my females that I treat, 90% of them who are on antidepressants get off of them. It's amazing. Once you restore a person's hormones, they're able to get off their antidepressants, their anxiety meds, because it's like you just bring them back to their youth, and there's oh my gosh, I can think clearly again.
You have something to be happy about. Yeah,
exactly.
That would be happy. I would be happy. 25. I remember when I was 25.
Yeah.
I just don't want to have that job again. I just don't want the job I had when I was 25. So is there, okay, I know somebody's going to ask this. Boy, the phones are lit up, by the way. I don't know if you want to take calls or not, but so do you want to take phone calls?
Absolutely.
Okay, we can take calls. But real quickly, before we go to the phones, do you take insurance? Does insurance pay for this?
Most insurances don't. We do not take insurance, and most insurances don't cover this type of therapy. It's unfortunate they don't recognize it as a true medical problem. It's more of an elective type therapy.
Wait till it happens to one of them. Just wait.
Right, exactly.
We need another old president, because then it'll change everything.
That's right.
Exactly.
All right, let's go to the phone. Our guest is Dr. Christopher Asandra out in Las Vegas, and what you do there stays there, by the way.
That's right.
Good morning. You're on the air. Thank you for waiting. You're on the air with Dr. Asandra.
Yes. Good morning, doctor. Can raising testosterone promote prostate cancer in older men?
That is actually a theory that a lot of people think. There's some studies that show it does. A lot of those studies that did show it raised the cancer rates were actually done in the early 90s. A lot of the newer ones after the 2000 have shown it really there's no correlation there. In fact, low testosterone, guys with very low testosterone, has been linked with increased prostate cancer risk. The goal here isn't to replace you with high levels of testosterone here. And again, I think if it's done under a medical supervision, et cetera, it's safer. We don't want to give anybody who's had a previous history of prostate cancer because of those old stigmas. We tend to not treat those guys with testosterone, but we can treat them for erectile dysfunction.
Okay. Let me take another phone call. Good morning. Thank you for calling. You're on the air with Dr. Asandra.
Yeah, since insurance don't take care of it, what's the cost and what's the side effects? And people with diabetes, how would that affect them?
Okay.
Diabetes is one of our, we treat several men with diabetes here, and that's usually one of the signs that cause erectile dysfunction and low testosterone. So we're able to treat men with diabetes, but we usually suggest that if you have diabetes, get that under control first, and then we can start helping you. Now, the cost of the consultation is only $99, and come in, you meet with one of the medical providers or a doctor. We check your blood work, which includes your testosterone, your estrogen, your blood sugar, your prostate levels, and then everybody's different, so we devise a plan based upon what we find and what your history is, because not everybody is treated the same. So therefore, everybody is treated different, so it's kind of hard to put a cost on that. But what I can say is the treatment's only, or the consultation's only $99. And if we are unable to help you, or with our erectile dysfunction medication, the visit's free.
All right, and I know that we had an abbreviated visit today, but you are coming back, I think, in a month. Robin said, right?
Yeah.
And
fourth Thursday.
Now you have offices in the villages. I want the listeners to know this is not something you have to travel to Vegas to get.
It might be fun, though.
I'm just.
Might be fun. Yes.
We do have an office here as well, and that's what I'm just checking on here today. But I'll be back in the villages this week, and I just wanted to stop by and see my other clinic here and
okay.
get away for a bit.
So give us the first step before we run out of time. Do you have a phone number, a website, or both?
Yes,
I know the ads are running. Go ahead. I'm sorry.
Yep. The best thing to do is go to the website, www.numale.com, and that's NuMale.com, NuMale.com, NU. And that's the best place to start, where you can start reading about the treatments, et cetera. Our phone numbers and locations are listed on there, interviews with me, and some information that may answer your questions about what the callers are asking about.
Real quickly, since we have another minute and a half or so, do you have any success stories you can tell us about? You sort of kind of hinted at one or two during the course of this conversation.
Absolutely. I had a couple that I treated here just about a month ago. And, they were coming in. His wife was literally about to leave him. It was on the brink of divorce. Their relationship was in disaster. It was, in distress and everything. This guy wasn't able to achieve erection probably about 6 years or so. And he was severely depressed, and he was just feeling down. He was holding his head down there. Well, I said, guess what? We're going to try to treat you here. We'll see what we can do for you. With that one visit, I was able to get him functioning again down there. I replaced his hormone levels. In 2 weeks, he came back and said, "Doc, you saved my marriage." We're able to go on a second honeymoon again. It's like they hadn't had this type of relationship that they once had. He said probably for about 10, 12 years. And, for 6 years, he wasn't able to function. And it wasn't his fault. It was diabetes, high blood pressure that had affected him. But he was on all these different medications that affected his function. Well, we restored that. And, now the wife she gave me a hug and everything. And she says, "Now, Doc, hey, fix me now."
Oh,
yeah,
wow.
man.
How wonderful.
It was amazing.
Who says women don't want sex? You see? See, the cartoons make you think, thank God he's done with that phase of his life.
That's right.
But instead she wants to leave him for some younger guy, probably.
Yeah.
Yeah.
No.
Well, that's actually the story. It was, he was letting her, he was like, what, honey, he was at the point where he said, "Honey, I don't care who you go out with now, just don't leave me." But we restored his function, and he's I still remember his name. His name was Craig, and he's absolutely just ecstatic now. Their relationship is restored. And I think they still have some, they should still go to counseling like you suggested earlier, et cetera. But for that part, the intimacy, we were able to rekindle that. And I think that's an important part of the relationship. It shouldn't really be seen as a dirty thing, because intimacy is part of the overall relationship.
Part of life. Are you kidding? We all pretend it's we don't do it, but we all do it.
Right.
All right. Well, Doctor, thank you so much for being on the air with us. I'm looking forward to meeting you in person. Dr. Christopher Asandra, again, the website was NuMale.com. I just went there, by the way, and if you go there, you'll see this guy who looks like a bodybuilder. with a beautiful woman hanging on his back. So that's enough to get me down there. And also medical weight loss you do too. You didn't talk about that.
Yes. Yeah, medical weight loss we do. We check their hormones. We optimize their hormones that way. We get them on the right supplementations to do it. We have a diet plan in the villages. We have one of our patient counselor there is a personal trainer as well and a dietitian. He can help you talk through if you know right meal plans and everything to get you to lose those extra pounds.
Does the hair come back too if you've lost your hair?
Mm-hmm.
The hair, we do have a hair restoration procedure that we do. It's called neograft. It doesn't use there's this old method they call the Bosley method, where they actually take a strip from the back of your head and cut it up, and you have this big incision.
Ooh.
Ours doesn't have any scarring or anything. We have a special machine that just kind of plucks the hair follicle from random locations in the back, and then we transfer them to the front.
Oh, my.
Wow.
Fascinating.
Wow.
This is an
Well, new technology
amazing
out there.
clinic you have.
All right.
sir.
Well, don't lose too much money in the casinos.
I will not.
Doctor, that was fun. Thank
I
you.
don't gamble.
You're a great guest. Great guest. Thank you for being on the show. Looking forward to having you in the studio. Again, the website is NuMale.com, NuMale.com, but it is for men and women as well. Thank you, Doctor.
Thanks for having me.
We'll take a little break. We'll be right back. Robin, let's try a little plant trivia. Name this nursery. It's a not-for-profit, and it teaches growing and caring for plants to their students.
Oh, that's easy. Kenny's Place.
Or how about this one? It's a nursery conveniently located between Ocala and Bellevue.
Again, it's Kenny's Place.